Effective patient care can be a challenge when doctor and patient do not share proficiency in the same language. Currently, about 9% of the U.S. population has limited English proficiency, meaning people who do not speak English as their primary language. That includes 6% of the Indianapolis population and 3% of the state of Indiana. Language barriers due to limited English proficiency can lead to less access to care, fewer physician visits, increased complications, and other health disparities. Interpretation services in healthcare are used to help overcome language barriers between patients and healthcare providers. Medical interpreters are communication professionals who are trained to be neutral parties in doctor-patient conversations. They are strictly there to provide translation between languages while maintaining confidentiality and patient privacy. Interpreters have a specific role in healthcare visits and should not be expected to counsel patients on medical decisions, explain illnesses, procedures, or other medical topics, clarify or fill in the gaps of information given by providers, or act as a patient advocate. Now, let's explore some best practices for a visit using the services of a remote interpreter. Before any encounter, make sure you gather any information the interpreter will need, including patient name, medical record number, and location identification number. Familiarize yourself with the video interpreter equipment. Position the video equipment to the side between patient and provider so all participants in the conversation can be easily seen and heard. Using a triangle position gives everyone, the patient, the medical professional, and the interpreter, the best vantage point to communicate with each other. Throughout the visit, speak directly to the patient at a reasonable pace and volume. Remember that speaking slowly or more loudly doesn't improve understanding. For the most effective communication with your patient, keep these tips top of mind. Be sure to use short phrases. Ask one question or explain one concept at a time. Keep it to one sentence. As you would with any patient, use layperson's terms to explain medical procedures and terminology. And to avoid misunderstanding, do not use slang, idioms, or metaphors. Assume and request that everything said by all parties is interpreted. Try to avoid interrupting the patient or the interpreter. Always provide adequate time for interpretation and pauses for clarification. Finally, use the teach-back method to make sure your patient has understood any pertinent information or instructions. Interpreters can enhance communication and understanding between providers and patients. When you follow best practices in using interpretation services, you are doing your part to promote healthcare accessibility and equity for patients with limited English proficiency.